News now, Alzheimer's and other types of dementia place a tremendous strain on caregivers.
Most are women family members who report very high levels of stress and downright depression. CBS 2's Dr. Max Gomez recently attended a seminar that taught caregivers how to ease that stress. Dr. Max?
Christina Maurice, it's been called the long goodbye. Your loved one is still there in body, but is slowly disappearing in mind and spirit. I know, I watched my father go from a respected physician to a shell of his former self. It's painful and frustrating, but there are ways to ease the stress.
Oftentimes she'll call me mom or miss, or you know, sometimes she'll use my name, but I'm not sure that she knows that I'm her daughter.
Karen Ferrari is caring for her 98-year-old mother with dementia. Karen had to retire and move back from Nevada, leaving her husband behind. Clearly an act of love, but which doesn't always play out that way.
Sometimes I'll be so angry at her, you know, because she'll get so angry and over such an unreasonable thing. And so you wind up yelling at each other. And I'm like, oh my God, who's the adult here?
They're no different than us. They don't want to be controlled. They don't want to be told what to do.
And that's why Karen and dozens of other dementia caregivers came to a seminar at the Valley Hospital in New Jersey last week to learn strategies for improving their caregiving relationship. Carrie Mills, who calls herself a dementia coach, says the first thing to do is dump the term caregiver and start thinking in terms of care partner.
Establishing the role as partners means both give and both receive, and then it makes for a much more fruitful relationship. It gives caregivers the opportunity to still live their own life and take care of themselves. Otherwise, they end up unknowingly taking this martyr role, and in doing so, they don't do right by themselves and then by the person by dementia.
The next most important thing is to stop trying to control the person with dementia.
Take somebody who doesn't want to take a shower. Pretty normal thing that happens for many, many people with dementia. It's not that they don't want to shower, it's that they either think they have or think they're going to. They don't recognize their situation for what it is, but instead, if we say, hey, you know what, tomorrow we're going to that farmer's market that you love. Let's make sure we both look good before we go, because then we'll go to a restaurant for lunch. It may make them more inclined to just get themselves kind of fixed up for the day.
And Kerry says that's not lying to them. It's managing the situation by telling the patient what they need or want to hear to get them on board. But even a good care partner sometimes needs a respite. The Alzheimer's Association is a great resource for stressed out family members. It's tough.
Very tough,
yeah.
Doctor. Thank you.
You bet.
Great advice.